Hello everyone, my name's Megan and I'm a general dentist working in Swindon.
Hi, my name's Elizabeth and I'm also a general dentist working in Warminster.
And today the session aims to cover any questions you might have with regards to common dental problems encountered during pregnancy and how to maintain good dental health for yourself and your baby.
So one of the main problems encountered during pregnancy is bleeding or sore gums. And you may have heard this being called gingivitis, or in later stages periodontal or gum disease. This can result from hormonal changes seen in pregnancy, which can make your gums more sensitive to plaque bacteria found in the mouth, which can worsen any existing gum disease. And whilst this is reversible with improved brushing and dental hygiene, if it's left to progress, then you may develop more advanced gum disease, which can eventually lead to wobbly teeth and tooth loss if not treated. There are some known links between gum disease and the risk to the unborn baby, including premature birth and low birth weight babies. Therefore, it's really important not to ignore the signs of sore and swollen gums and to attend the dentist where possible.
We recommend brushing the teeth and gums twice a day for at least 2 minutes with a small-headed, soft or medium bristled toothbrush and about a pea-sized amount of fluoride toothpaste. After brushing, spit all the remaining toothpaste into the sink and try not to rinse your mouth out with water afterwards. This helps to keep the fluoride on the teeth and strengthens the tooth enamel. It also helps to reduce the amount of acid produced by plaque, which causes tooth decay. Focus on angling that brush to where the gum meets the tooth, plus interdental cleaning, so using either floss or interdental brushes daily if you can. As most of you are aware, dental treatment is free during pregnancy and up to 1 year following the birth of your child. Speak with your midwife or GP for more information with regards to obtaining a maternity exemption certificate, which you can take with you to your dental appointments.
So we have had quite a few questions about difficulties in getting dental appointments due to COVID. At the moment it does vary from practice to practice, so we can't comment directly. However, all practices should be prioritising patients in pain or emergencies and accommodating patients as best as possible. We appreciate that it is a very difficult time and most practices are still getting through a backlog of existing patients and do have a lower capacity due to the COVID-19 safety measures that have been introduced.
We understand that free dental care is an important benefit for new mums, and as far as we are aware that there are discussions to extend the maternity benefit for a further 6 months, but at present there's no clear guidance on this, so we can't comment. But should you need an emergency appointment or emergency care, please call your practice or NHS 111 for any urgent problems.
So we have been asked about routine checkups in the 3rd trimester. So routine dental treatment is safe during pregnancy. However, we tend to delay both treatment and x-rays until after pregnancy. This doesn't mean that the treatment and x-rays are harmful to the baby. So therefore, if you do need treatment in an emergency, then that's absolutely fine. Most treatment is best carried out during the 2nd trimester. However, like I say, emergency treatment can be carried out at any time, including x-rays if needed. So we also had a question from Emma who asked about attending during the 3rd trimester from a COVID perspective. So in all dental practices, all measures are taken to reduce the risk of COVID transmission, including PPE, hand hygiene and appropriate infection control procedures. However, it is down to personal preference, so if you would rather delay your treatment, then that's absolutely fine too.
So other things to consider during pregnancy are diet and morning sickness. So be aware of cravings, which can lead to snacking and a high sugar intake, since this will increase the risk of tooth decay. A healthy diet is not only good for you, but the health of your unborn baby. Okay, so consider limiting the amount of sugar you eat, keeping sugar to meal times with no more than 4 sugar attacks a day. So that's your breakfast, lunch, dinner and a snack. In between meals, it's recommended to drink only water and unflavoured milk. Okay, so as other drinks can be high in sugar or quite acidic. The Government Eat Well Guide is a brilliant resource which helps to plan balanced meals. Now, if you're suffering from morning sickness or in more serious cases, hyperemesis gravidarum, during your pregnancy, avoid brushing your teeth directly after vomiting. The acid in the vomit will brush away your healthy enamel, so try rinsing your mouth with water and waiting to brush for at least 30 minutes afterwards. Other tips and tricks include pushing on the bottom of your chin whilst brushing, pinching your fingers together, breathing through your nose and using distractions such as listening to music to try and avoid vomiting. Finding a time of day when it's most comfortable to brush. For example, if it's worse in the mornings, consider using mouthwash in the morning and then brushing a tiny bit later where you're less likely to vomit, so later in the day. An electric toothbrush can also be quite useful and reduce the jerky motions as you normally get with a manual brush, and a smaller headed electric toothbrush is helpful too. So some of you have been asking about breastfeeding and decay, and as you're aware, breastfeeding provides the best nutrition for babies, and we encourage this wherever possible. There is evidence to suggest that breastfeeding to 12 months reduces the chance of dental decay, and according to the World Health Organization, on-demand breastfeeding is recommended to 2 years and beyond. Very occasionally, some children will get decay from on-demand nighttime breastfeeding over the age of 12 months. However, since decay can be caused by multiple different contributing factors, there's not enough evidence to suggest that breastfeeding alone is the cause for the decay. So in summary, trust your instincts, do what's best for you and what's best for your child.
So someone had mentioned milk pooling and the increased risk of decay with that. So when breastfeeding, the breast and nipple are directed to the back of the mouth, so you don't tend to get any pooling with that. Whereas with bottles, because the tip of the bottle seats a bit further forward, that can increase the risk of pooling. So bottle feeding obviously is a good way to provide nutrition to the baby, but try to avoid placing anything other than water or unflavoured milk in the bottle. So this includes no fizzy drinks, squash or fruit juices, and ideally only water at night time. It's also a good idea to discourage your child from using a bottle as a comforter, as this can become a difficult habit to break, a lot like using a dummy. Again, dummies not ideal. They can cause problems with the alignment of teeth, which can then later require orthodontics to fix. We also recommend that the child should start to drink from an open cup from as early as 6 months or wherever possible. And your child may be introduced to solid foods from the age of about 6 months, but again, try to avoid adding sugar to any weaning foods or drinks.
So what are neonatal teeth? So these are teeth that might appear in your baby's mouth as soon as they are born or up to 30 days afterwards. So these may be the milk teeth coming through a bit earlier than normal, or they could be extra teeth. Okay, so therefore it is important that the child sees a dentist. The teeth might be left in place if they're firm, but if they are a bit loose, at risk of inhalation or preventing successful breastfeeding, then they might be taken out. So we have had a few questions through asking whether it's normal to have X number of teeth at X age. On average, the first tooth begins to come through about 6 to 10 months. However, this can vary amongst children, so some may appear much earlier than this, or even later. So your child might not get any teeth till about a year old. Okay, so baby teeth will continue to come through until the child is about 3, so that's 36 months. But any concerns with any of the number of teeth present, please contact your dentist, but usually it will be normal, okay? It is important to start brushing your baby's teeth as soon as the first tooth appears. We appreciate this can be difficult on a wriggly baby, so keep trying. It might be easier to try brushing their teeth in a high chair to keep them still, or even just distracting them, so during bath time. It can also be beneficial to clean the gums following a feed. You can use baby dental wipes which contain xylitol, so even if there are no teeth present yet, just give them a bit of a wipe around the gums.
So Tess had mentioned that there's some conflicting advice as to the amount of toothpaste that should be used and whether it can be swallowed or not. And Kate was also asking about the strength of fluoride in toothpaste recommended for babies and toddlers. So for children under the age of 3, we recommend using a toothpaste with no less than 1,000 parts per million of fluoride, and using sort of a smear on the brush. And then for children between 3 and 6 years old, you can use the same concentration of fluoride, but use a pea-size amount. And then for children over the age of 6, you can start to introduce the use of adult toothpaste. Again, all of this will be on the toothpaste tube and should tell you whether it's age appropriate or not. And when brushing, we advise to try and get the child to spit out as much toothpaste as possible. This may be difficult at first, but usually by the age of sort of 3, children tend to be fine with this. It can help sort of smush the toothpaste into the bristles of the brush so that they don't try and eat it straight off the brush.
Okay, so Katie has asked how long should she be brushing her 16-month-old's teeth for? We don't want you to focus too much on the time taken, since the amount of teeth present will vary on the age of your child, okay? So it's really important to just focus on each tooth individually and making sure that you're brushing all the surfaces of the teeth, so the front, the back, the sides and the tops of teeth. And just a quick sweep around the gums with a finger or a soft gentle brush will be fine. Okay. We also had a question from Min, who asked whether it's normal for her 3-year-old to be teething despite having all 10 teeth. We assume you mean 10 teeth on top and 10 teeth on bottom, as it should be expected at this age to have a total of 20 teeth. It's unlikely that these teeth are the adult teeth coming through early, as the first adult tooth doesn't usually come through until around 6 years old, and that will be behind the baby teeth, so that same area. But sometimes children can present with extra teeth, or teeth might divide or split when developing to look as if there are extra teeth in the mouth. So these can normally be monitored until they are lost. However, since we can't see your child, we cannot advise, so I would advise you to seek advice from your dentist if you can. As teeth start to come through, your baby's cheeks can become red, and you might notice them having a slight temperature. They might begin dribbling more frequently. This is completely normal and are the common signs of teething. So to help soothe your baby, consider gently brushing the gums with a soft bristled brush, using teething rings. Some teething gels may also help to reduce the pain, and can be applied with your fingers directly on the gums.
So we've been asked about when your child should first visit dentist. So we advise that children should start visiting as soon as their first tooth comes through, or at least by the age of 1 if their first tooth hasn't come through by then. So this is really important to try and get them used to the sounds and smells of the dental practice so that they can build healthy habits from the very start. They should then receive a minimum of yearly checkups to ensure any problems can be picked up early, but this may vary from child to child, and this will be determined by a dentist. So Alison asked a question about the risks of on dental health for children with allergies to milk or lactose, and whether they should be given any supplements. So obviously calcium is really important for building teeth. However, there are plenty of other sources of calcium, such as leafy green vegetables, fish where you can eat the bones, such as sardines, and things like oranges. With regards to supplements, it's best to seek advice from the child's GP, as obviously this can have an effect on the rest of the body as well.
So we've had a question through from Annie asking about a 4-year-old with staining on the teeth, what causes staining and how to clean it. So staining on the teeth might indicate either a dietary cause, so it could be from the things that we eat, a developmental cause, so some teeth come through with white or brown patches due to changes in the normal tooth making process. However, it might be an early sign of decay, therefore it is important to get it checked by a dentist if you can. They'll also be able to advise on how to remove any stain dependent on the cause, and it does change depending on what caused it. However, continuing to brush at home twice a day with a fluoride toothpaste, as discussed previously, is really important to try and prevent any decay. Rachel has also asked what to look out for, as she is struggling to get an appointment for her 4-year-old due to the current circumstances with COVID. So when brushing, just look for any black, brown or yellow spots in the teeth, because that might show decay, or any holes in the teeth. Monitor your child's behaviour. If they're not eating properly, if they change their eating pattern, if they're pointing to any teeth, if there's a swelling or a pimple on the gum inside the mouth, a change in sleeping pattern, this might indicate a problem. So if your child is experiencing pain, they should be seen as an emergency. So do call up local practices. If not, call the NHS 111 number for any urgent dental care, and they should be seen.
So our final question was from Callie about tooth whitening and whether or not it's safe during pregnancy. So the current UK legislation states that tooth whitening treatment should not be carried out for pregnant or breastfeeding women. And whilst there is limited evidence, it isn't deemed an essential treatment, and therefore current guidance has decided to err on the side of caution, but this is designed to protect both the mother and the child. Thank you so much for listening. We hope this has been really helpful and answered some of your questions.
If you require any further advice or guidance, reach out to your dentists, your midwives, your health visitors, who will be more than happy to help. Thank you again.
Thanks, bye.
Bye.